Welcome to part 3 and the final in our segment on private healthcare exchanges with Walgreens. So first off, I want to go back to the rationale used behind choosing a fully insured program. Can you talk more about that?
I think in the traditional world of fully insured, and even in the self-insured world, I think the challenge with that is that the carrier has a one-to-one relationship with the employer. And the carrier has to build tools and resources based upon the needs of that one employer. And so it isn't efficient. In this private exchange model that's been set up by those who have a fully insured solution, the fully insured market leverages the triangle that is healthcare, the employer, the carrier, and the employee. And it tries to bring that triangle to a level playing field where the employer is not the one with all the risk. In the self-insured world, even in the traditional fully insured world, the employer still carries all the risk. They're the ones who have to make the decisions. But in this model, with the one-to-many relationship, you're leveraging the resources of that carrier across a lot of employers and tons of employees in one single platform that's similar across all those subsets of the market. And that carrier is then able to better price and build risk around that model. And that levels that triangle so that there's even risk for all three parties involved. And that fully insured relationship, the one-to-many relationship, and the marketplace that's created out of that to compete for each of the employees that are going to be in that market is huge to leverage the driving down of premiums and the management of claims at a much more personal level, so that the relationship is no longer the employee to the employer to the carrier, it's the employee to the carrier. And that is a huge advantage in this particular design that over time will likely win out.
So you've now got about 5 months or so of operation under your belt. What's it looking like now? And talk about some of the metrics that you're using to ultimately assess the success.
So let's go back to open enrollment, because there's several key things for you to understand there, Allison. So first of all, we had more people go on to the enrollment site and make an active decision than we'd ever had in our history before. The second thing is that we had a lot of people enroll their dependents on this plan where they may not have before. So they were looking at choices maybe from a spouse's employer or some other way of getting health care. Obviously, the Obama administration is kind of mandating through the Affordable Care Act that people get health insurance. So we actually added some lives to our health plan, and it was about what we had kind of predicted or forecasted would happen. Another thing that happened is Aon Hewitt, through its enrollment site, did a survey of people who went on and enrolled and asked them some questions about their experience. And there were a couple of key things I want to share with you that we thought were particularly exciting. First of all, about 3 out of 4 people who enrolled and took the survey indicated that they now understood how their employer was investing in their health insurance program. And that's very exciting to us. The second thing is they told us a number of things about their experience with the website and with the phone support tools if they used them. And over 85% of people said that their experience was positive or very positive. So back to, early on, we had some very, very strong indications that we had done a good job of communicating, that people went on the website, that they enrolled in record numbers, and that their experience was very positive.
What challenges or opportunities is your organization now facing with having this 5 months under your belt?
Yeah, so I think we did some customization because of who we are and some of the goals we had to meet. For example, we don't have an HSA, we have an HRA. We believe as a pharmacy that pharmacy and the deductible is wholly incorrect. It only makes people avoid pharmacy costs and pharmaceutical adherence. So we have an HRA, a health reimbursement account that members receive deposits into, like we talked about, for wellness, that offset some of their deductibles and copays. That structure is different than the rest of the marketplace. And whenever you make customizations, there are challenges, and we've learned some of those challenges. I think one of the largest learnings for us is that the differences between the way the carriers handle certain coverage is different, and we weren't anticipating that difference. For example, one carrier calls this list of procedures preventative, and this other carrier has a shorter list. That difference was a little bit of a surprise. We were working through that, trying to understand it, trying to be sure we're able to communicate those differences to our team members going forward. Plus, we've also had some challenges in the prescription drug design. We did customize that as well because we have a co-pay coinsurance structure because of the HRA rather than it being in the deductible, and we have a narrow network for Walgreens. And whenever you customize again, I think you run into challenges, and we've had to deal with each carrier as we've worked through those challenges.
One of the other things that we noted now is how many people, stuck to the sort of core silver plan, how many bought up, if you will, to a gold or platinum, how many bought down to a bronze plus or a bronze. And it was pretty much the way we had anticipated, and pretty much the way Aon Hewitt had experienced with their other customers in the exchange in prior years. So close to 50% stayed centered on silver, and about 30% bought down and about 20% bought up in rough numbers.
So in looking back, you've got kind of a larger perspective. You're continuing, and I'm sure learning every day. We've talked throughout this video series about a lot of the hurdles, a lot of the lessons. Are there some high-level, overarching lessons that you've learned as an organization from this effort?
I would say that even though we're very anxious to tell our story, and we're really interested in helping other professionals such as ourselves really understand what Walgreens did, and it was very visibly in the media a few months ago and pretty much continues to be. My encouragement to my professional colleagues would be that we're happy to tell our story and to share with you what it is we did, and hopefully you can learn from our experience. But this may not be for everyone. We realize that due to our size, due to our geographical complexity, we do have employees in all 50 states, for example. That some of the advantages of sharing the risk with the carriers, as Tom mentioned, may not be for everyone. So if you're a smaller employer, or if you're an employer with a concentrated population density in one particular region, depending upon what that region is, something like this may or may not work.
A classic example of not one size fits all, right?
Exactly. And I think also you can never shortcut the fact that your leadership needs to be on the front. We've said that many times throughout this process. Communicate and communicate and communicate. It's the safest bet. And then also, as you're analyzing whether or not this is the right thing to do, take time and involve the right people in that decision-making process so that you're not shirking it if it turns out to be the right thing, or embracing it when you need to embrace it and when it's right for your organization.
Tom and Mark, thank you so much for sharing insights and what you've learned, and also your advice for going forward.
You're welcome. Thank you.
Thank you.
For World at Work TV, I'm Allison Avalos.